Joining us now is Dr. Robert Murphy. He is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
Well, it's shocking to see Illinois at the top of the list. Why us? How did we get here? And what are your thoughts on this hotel wedding? Is there something government can do to keep these things from happening instead of just suggesting that they don't happen?
Yeah, right. Well, I think your comment is true and right on. You can't just suggest to people to do stuff. It's a public health hazard. It's a menace. We're in a pandemic. There's got to be strong rules with teeth in them. And the problem is there's really, in this country, no real central direction about what to do. Now, you heard just now President-elect Biden saying that he's going to have a 100-day mask mandate. At least that's like the train is now going in the right direction. What we have, the fact that somebody has a wedding where people are not wearing masks or social distancing with hundreds of people in a hotel, I mean, the hotel should be fined, but there's no law against it, I presume. But we've got to have some teeth in these laws if we want to make a change. Otherwise, we're going to have the highest death rate. Illinois is the 6th or 7th most populous state. We have the highest number of deaths. What is going on here?
Interesting, though, that there's a study that says Illinois schools are not the super spreaders we thought that schools would be. How do you account for that?
Well, Robin, this is how we like to report in this country. You know, okay. First of all, the city of Chicago schools are basically closed. So you have just the private schools and the religious schools that are open. 16 of them had an outbreak and had to be shut down. All right. Is this good? No, this is not good. But okay, yes, it could be worse. It can always be worse. 482 schools had a lot of cases, but they didn't qualify to actually shut down. So is this good? This is not good. All right. Let's get that straight. It could be worse.
Yeah.
This is what we're dealing with.
Yeah, can you talk about these manufacturing issues that Pfizer has? I think people were very hopeful when they heard the news, and now are we taking a big step back, or is this a minor blip?
This is a minor blip. This is a very complicated process, and further complicated by the fact that everything has to be shipped at minus 94 degrees Fahrenheit. Add that to the equation. But to make a vaccine, you wouldn't believe everything that has to go into that product, all right? And the way that it has to be kept frozen and all that stuff makes it even more complicated. They had a little blip in their supply chain, a material part of the whole process here, and they're not going to be able to make all the vaccine they promised for 2020. 2020. It's the 4th of December today. You know, we're not talking about the next 3 weeks. You know, it's not like far away. They're still on track to deliver all those vaccines and the 1 billion vaccines next year. This is a blip, but this is typical supply chain problem. And this whole locomotive is going so fast. Any little blip, and you get, the result is tens of thousands, millions of doses get affected.
I quickly want to ask you about the idea that people that get vaccinated would get a card, or the CDC says a button that says I'm vaccinated. Couldn't people just take that button from someone else and walk around with it?
I was waiting for that, and I brought my international health card. If you travel any place where there is Lassa fever, this is a mosquito-borne disease that can kill you. It's a deadly, deadly disease. You have to have this card, or you get quarantined or sent back when you land in an airport in any one of these countries. And I work a lot in African countries that require this. And this is going to be the future of the COVID vaccine thing. There's going to be a little place in here, I'm sure, that you can slip that card in, and you're going to be traveling around and showing, you know, here's my yellow fever page. You know, it's going to be the same thing for COVID. Okay. I'm sure that's going to happen.
But what's to stop someone from taking someone's button or card and passing it off as their own?
It doesn't look like it has a picture on it.
It's well, exactly. There's no picture on here. And that is called fraud. And fraud is illegal. And you commit fraud at a border or an airport, you're going to get in trouble.
All right.
Yeah. Paul knows that very well, but it's a story for another time. Viewer questions. My fiance tested positive for COVID last month. I was not able to quarantine, so I was exposed for the entirety of his illness. I got 2 negative PCR tests during those 2 weeks. Could I be immune, or should I still be worried about contracting COVID?
This is a very common scenario. You could be immune. That's possible. I don't think so. I mean, I think the more likelihood is that 70% of people who are infected don't even spread it to anybody. So you're just one of those 70%. Yeah. Remember, this whole epidemic is being spread by the super spreaders. They're only a chunk of everybody that's infected.
All right. Would it be more prudent to give the frontline workers different vaccines, so if one vaccine has more undiscovered side effects, it doesn't hit one hospital or section in a hospital all at once?
Yeah, this is a very sophisticated question. I don't realize if this person, maybe they really understand the whole vaccine thing. The supply is going to be so tight and so short and so limited by the supply chain components and the cold chain requirements that you're going to be lucky to get a vaccine. So just get in line and take what's approved. If one of these vaccines is better than another, experts like myself are going to tell you, don't take that one or only take this one. You know, then we'll make a decision. But right now, the Moderna and the Pfizer look like they're working the same and that they're tolerated the same.
All right. Thank you, doctor. If you have a question oh no, we have one more. I am a hairdresser. I am 72. With so many cases, should I be watching my grandchildren? Does it matter my house or theirs?
Okay, it doesn't matter where. And it all depends on what's essential. So if it is a critical thing, you know, sometimes you have to do it. But this is a person, this grandmother is the one that should really get in the front of the line to get one of these vaccines.
All right.
She really, really could use it.
If you have a question for the doctor, post it on our Morning News Facebook page. We'll talk to him again on Monday. Have a good weekend.
Thanks, doctor.
Hey, great. Have a great weekend.
You too. Hey, Paul.